According to data from the World Health Organization, WHO, over 35,000 health workers had been infected with COVID-19 worldwide as of 21st April 2020. The WHO believes the number could be significantly higher because of underreporting. In Ghana, the Ghana Medical Association has disclosed that 13 health workers had been infected with the virus. In a bid to offer protection for health workers, a group of students from the Kwame Nkrumah University of Science and Technology have developed an app which makes it possible for persons who seek to visit health facilities to have consultations with doctors using the app. It has a video feature which enables a patient to speak to a doctor, including a GPS feature which makes it possible for the ambulance service to dispatch personnel to one's location once the need arises. The team lead for the students, Stephen Frimpong, explains how the app, which they have named COVID, works.
It's just one app, all right, but then it's divided into two. We have the user, that is the citizen's part, and the doctor's part. So the moment you open it, it asks you, are you a citizen or are you a doctor? Before you access the doctor's app, you need to be a doctor. That is through our database. We input list of people provided by the Ghana Health Service as qualified doctors. So if you are not a qualified doctor, you can't be on the platform as a doctor. So if you are not a doctor and you are trying to log in, it will tell you, hey, you are not a doctor. The only way you can prove yourself is if you go there and they really give you something to prove that you're a doctor, then we can input it. But if not, you can't. But for the citizens part, it's free for everyone. You just enter your mobile number and you are good to go. When you are logged in as a doctor, you don't just start working. No, there is a radio button you must press in order to start working. So if you take that button, then it will indicate that you are ready to work, and any citizen that goes on the app looking for a doctor to talk with would see your name there. So if you have not taken your button, it means you are not ready. So you can rest, and whenever you are ready to work, you just take it and you are good to go. Looking at the doctor's part, that is the special feature. And aside that, for the notification, whenever cases are reported, any doctor can see it on his or her phone, and then you can track the location. So if you click on the notification panel, a map shows indicating the number of people that have reported cases, and then if you select to go to this place, it gives you direction to his or her house so that you can go and pick the person or test the person at his or her house.
The app has been designed in such a way that one can easily see information published on the Ghana Health Service's dedicated website for COVID-19. Stephen says they are making efforts to engage authorities at the Ghana Health Service on how they can collaborate and operationalize it.
I'm making preparations to meet the health service in order to explain to them how it works and how it's going to help them, and at the same time how it's going to protect our doctors and improve upon their safety as they also work for us.
The students believe this innovation will help transform Ghana's healthcare system significantly, even after COVID-19, since it could drastically help reduce overcrowding at various health facilities across the country.
Beyond COVID, this app can also be used to help prevent or protect our doctors, especially from contagious diseases. Aside that, when the COVID issue is over, it can still be used for doctor consultation. Let's say someone has some small problem with him or her. Let's say the person is ill or is not that serious, it's not an emergency, and then the person has got work to do. It will improve the way citizens visit hospitals, because if most people would just decide, oh, for this one it's not serious, so I won't go to the. But if they know, hey, I have doctors on my phone, why not? You can just do consultations, doctor consultations through your phones.
The innovators say they are working on the app to make people access it even without using internet. They are also calling on various organizations and groups to support them financially to help make the app fully functional.